Can you introduce yourself and share a little bit about your background?
Sure. My name's Dave Kimball. I'm 79 years old. I had a 26-year career in the United States Navy. After graduating from the Naval Academy, I was very fortunate to get into aviation and flew all around the world with the crew doing anti-submarine warfare. During that time, I was able to get 2 master's degrees, one in underwater acoustics and one in teacher development, because I was going to become a teacher, and got swayed to go to McCarran Airport as an assistant director, and had a great time there.
Can you share a little bit about your home health journey?
My home health opportunities have been kind of wide and varied. In the last 5 years, I've had 2 shoulder operations, a couple of knee operations, 2 back operations. So it's been my share of time in hospitals and rehab. And each time I've had home health afterwards. So they clear you out of the hospital, and at a large expense for the insurance. I've probably had 4 different companies do physical therapy, or do therapy at home, physical, occupational, and nursing. About my 3rd time, I was lucky enough to have people in the rehab that were associated with Applegate. They very much impressed me, so when I got out, I asked for Applegate, and I've never used anybody but them since. The big difference in Applegate that I noticed is that the other companies, though they wanted to help you heal, are more interested in getting there 15 minutes and moving on, and I didn't really gain much. In Applegate, I've had fantastic people. I had a nurse for almost 5 months trying to heal my diabetic abrasion in the bottom of my foot. In fact, she's the one that realized that I had no pulse in my leg, and got my doctor to recommend I go to a vascular surgeon, who then operated on my veins, so that 2 months later my leg was finally healed. But it was difficult because I couldn't hardly walk. It hurt so much. And I was stubborn enough as an old Navy guy to not ask for the doctor to do anything, because it's the bottom of my foot, it's not like it's in your heart or your lung or something like that. So I've also, the other folks have been great for both physical and occupational. I had another special person from Applegate who kind of specialized. He was the head of the physical therapy at Stonehenge. He's since backed off a bit, but he had wrapped a bunch of people's legs trying to get their legs back to normal flow and stuff. Well, he has been sensational, both at Stonehenge and then following up. In fact, this recent bout where I was in the hospital because of an infection and other things, they sent me, whose home health care do you want to use? I said, well, Applegate. And he came almost just because he heard I was in home health care, and it was Applegate, so he saw it on their schedule. He came to check my legs, and I think the first time he came on his own without getting any reward financially. And we've developed really strong relationships with these people. So yeah, I can only give the highest praise to Applegate and our experience.
That's awesome. I love to hear that. And I heard you told me that your wife also was on home health. Can you tell me a little bit about that experience?
My wife's only 78, 9 months younger than me, but we were high school sweethearts. And she's been in the hospital numerous times for urinary tract infections, UTIs, and a number of other things. And she had a number of health care providers too, sometimes at the same time. We were in rehab at the same time for 2 months. But she quickly saw that Applegate was, a good step above anybody else. So she's had them here in both our last 3 houses. We're now in assisted living. She looks forward to actually the guys coming to do physical therapy, and they've changed our house for occupational therapy, from making her the toilets, changes to the toilet to make it much less likely that she'd fall, and numerous other things they've come up with to try to make life easier and better for us, more comfortable. So she's just as happy as I am.
I'd love to hear that. That's awesome. Looking back, how do you feel about your decision to receive home health care?
Looking back, it wasn't really a decision to get home health care. It was kind of a requirement to one, either get out of the hospital and be done with the hospital livelihood, bed beds, and so on and so forth, and being able to get home and take care of yourself. But you can't totally take care of yourself, and you still need recovery and various things. The other way was we were in rehab, and you can't stay in rehab forever. So as soon as you can, you get out of rehab, and then you have home health care. And the home health care has been almost as good as rehab. I mean, it really is. One difference is you have to cook your own meals. So now I'm in a assisted living, and they do the meals for me, so I still get home health care.
How did your family feel about the home health care you received?
They actually were excited that we were still getting somebody to come in and check on us. I have one of my daughters lives here locally with 8 children and 4 great-grandchildren for us. So we get a lot of visitors, but even at once a week, that doesn't make them real comfortable that we're doing okay. We've had to have the ambulance come to our house numerous times, and so they're very nervous that we are not going to be in a bad situation. And so that's one thing healthcare is doing. Not only helping us recover, but checking on us and making the family feel a lot more comfortable.
What advice would you give someone considering home health care?
As far as advice for home health care, I would highly recommend it to anybody. It's so much more pleasurable living in your own house and having your own bed than it is to be in a hospital or a rehab situation and getting almost the same care. You don't have the doctor coming through every couple days like you do in home health care. In rehab, but you keep your own doctors. And where we are now, they check on us every day to make sure we're still kicking, and that's what the active living community is like. I would recommend it to anybody, particularly insurance covers a whole lot more than I ever thought they would. I'm on Medicare, so I also have military medical retirement, TRICARE for life. Between the two, there's no cost.
That's awesome. Perfect. Well, sweet. Thank you so much, David.
That's it?
Yep.
Did I pass?
You passed.
Okay.